Good morning, everyone, and welcome to UroNurse News. I'm your host, Vic Senese. Today, we're tackling a question that might make your next dental visit a little nerve-wracking. Do dental x-rays really cause brain tumors? A new study from Yale Medical School, recently published in the American Cancer Association Journal of Cancer, has raised concerns about frequent dental x-rays, specifically bite wing x-rays many of us get at our annual checkups. Hey, don't forget to like and subscribe. So researchers found that people who receive bite wing x-rays yearly instead of the recommended every 2 to 3 years may have a 40 to 90% higher risk of developing certain benign, non-cancerous brain tumors. But I don't want anything in my brain. Now, before you panic, let's be clear. These tumors are typically non-malignant, meaning they're not cancerous, but they can grow large, potentially causing vision or hearing problems, frequent headaches, memory loss, and seizures. In fact, benign brain tumors are the most frequently diagnosed brain tumors among adults in the U.S., accounting for about a third of all primary brain and central nervous system tumors. Previous smaller studies hinted at a link between dental x-rays and these tumors, but their findings were inconclusive. This Yale study is the largest to date and shows a statistical association, though it does not prove that x-rays cause these tumors. Lead researcher Dr. Elizabeth Kloss, a neurosurgeon at Yale and Brigham and Women's Hospital, emphasized these findings should not prevent anyone from going to the dentist. Key. She points out that many patients still get dental x-rays yearly, when the recommendation for healthy adults should be every 2 to 3 years. Now that's important. If you're not having a lot of issues, they shouldn't be doing them so often. The American Dental Association also weighed in. They continue to recommend x-rays only when necessary, using protective aprons and collars and digital or fast-speed films to reduce radiation exposure. Might be a good question to ask your dentist what kind of equipment they're using. So keep in mind, dental x-rays they're important. They help dentists detect early cavities, gum disease, infections, and certain tumors. Children's, teens, and developing teeth may require x-rays more often, but for healthy adults, most dental experts agree less is more. Bottom line, if you're healthy and don't have symptoms, you probably don't need yearly x-rays. But if your dentist recommends an exam due to symptoms, risk factors, or history, it may be necessary. Talk to your dentist about the risk. So, do dental x-rays cause brain tumors? Well, the risk is extremely low. The link is not proven, but it's something patients and dentists should consider carefully, and perhaps space out your x-rays according to current recommendations. That's all for today's health alert on dental x-rays and brain tumors. This Saturday on UroPatient, we're diving into a topic that affects thousands of men every year, prostate stents. You'll discover how prostate stents relieve urinary blockages. We all kind of heard of the heart stents. This is one that goes in your prostate. The benefits, risk, and recovery you should know. What to ask your urologist before the procedure. This one was done actually based on somebody writing in and asking for it, so that's why we're doing it. Tune in this Saturday for clear, patient-focused insights from yours truly, so you can make an informed decision about your prostate health. Now here's one that's going to really be interesting. Tomorrow, men have been peeing wrong for years, and it's harming their bladders? Join me as I uncover the common mistakes men make in the bathroom and simple fixes that can protect your urinary and prostate health. Don't miss this eye-opening guide to peeing the right way. Tune in tomorrow to take control of your bladder health. That's it. We'll see you tomorrow.
UroNurse Speedrun. Let's learn and share on YouTube, LinkedIn, X, and Facebook, everywhere.